Hair loss, also known as alopecia or baldness, refers to a loss of hair from part of the head or body. It's true that men are more likely to lose their hair than women. But thinning hair and hair loss are also common in women. Reasons can range from the simple and temporary, a vitamin deficiency, to the more complex, like an underlying health condition. In many cases, there are ways to treat both male and female hair loss. It all depends on the cause. Any kind of physical trauma, surgery, a car accident, or a severe illness, even the flu, can cause temporary hair loss. Hair loss often becomes noticeable 3 to 6 months after the trauma. Don't worry, your hair will start growing back as your body recovers. Pregnancy is one example of the type of physical stress that can cause hair loss. If you do experience hair loss, rest assured that your hair will grow back in a couple of months. Overdoing vitamin A containing supplements or medications can trigger hair loss. This is a reversible cause of hair loss, and once the excess vitamin A is halted, hair should grow normally. If you don't get enough protein in your diet, your body may ration protein by shutting down hair growth. There are many great sources of protein, including fish, meat, and eggs. If you come from a family where women started to have hair loss at a certain age, then you might be more prone to it. Unlike men, women don't tend to have a receding hairline. Instead, their part may widen and they may have noticeable thinning of hair. Male pattern baldness is caused by a combo of genes and male sex hormones. There are topical creams and oral medications that can halt hair loss or even cause some to grow. Surgery to transplant or graft hair is also an option. Anemia is an easily fixable cause of hair loss. Some of the drugs used to beat back cancer, unfortunately, can also cause your hair to fall out. Chemotherapy is like a nuclear bomb. It destroys rapidly dividing cells. That means cancer cells. But also rapidly dividing cells like hair. Polycystic ovary syndrome is another imbalance in male and female sex hormones. An excess of androgens can lead to ovarian cysts, weight gain, a higher risk of diabetes, changes in your menstrual period, infertility, as well as hair thinning. Because male hormones are overrepresented in PCOS, women may also experience more hair on the face and body. Treating PCOS can correct the hormone imbalance and help reverse some of these changes. Vigorous styling and hair treatments over the years can cause your hair to fall out. Examples of extreme styling include tight braids, hair weaves or cornrows, as well as chemical relaxers to straighten your hair, hot oil treatments, or any kind of harsh chemical or high heat. Because these practices can actually affect the hair root, your hair might not grow back. A hair transplant is an amazing procedure that can make a huge difference to your hair and your confidence. Hair transplants are remarkable procedures, and the process behind it is almost magical. Many people will experience some hair loss during their lifetime, while some hair shedding is normal. Excessive hair loss is a problem that needs to be addressed. One of the ways that many people choose to combat hair loss is hair transplantation. This is a procedure in which healthy follicles are harvested from the scalp and implanted into the problem areas to achieve natural, normal-looking hair. Improving one's appearance is the primary reason why people with hair loss choose hair transplantation as a solution. Hair transplantation can improve one's self-image and boost self-confidence. It can also make one appear younger. And it can improve business and personal relationships in one's life. In our society, having a full head of hair is a signifier of health and success. For men and women, thinning hair can have a negative effect on one's sense of self-confidence and may make people feel less attractive. Hair loss negatively affects the quality of life. Modern hair restoration techniques offer a solution. Traditional hair transplantation, also known as follicular unit transplant, involves the removal of a narrow strip of hair from an area of the head, usually the back of the head, and transplanting these hair follicles onto the thinning and bald areas of the head. The hair follicles harvested from the donor area are resistant to the hormone dihydrotestosterone, D.H.T, which is the hormone most responsible for progressive hair loss. When transplanted, these follicles will continue to grow naturally. The hair transplant procedure is typically performed under local anesthesia, making it a pretty simple outpatient procedure. Depending on the extent of the hair loss and amount of grafts to be transplanted, the procedure can take anywhere from 4 to 8 hours. In an advanced technique, follicular unit extraction is also minimally invasive and it is a common method of hair restoration today. The procedure requires a surgeon to harvest healthy hair follicles individually from their donor area for implantation in the affected area. Biocompatible hair is well tolerated by the skin tissue and not harmful for the human body. It does not break and allows a long-lasting aesthetic effect. These synthetic implants have several advantages over hair transplantation surgery, such as no pain and no stitches. The color and length are chosen according to the preference of the patient. This type of artificial hairs can be completely removed as single fibers. Synthetic hair is available in different lengths, styles as straight, wavy, as well as curly. These are safe, effective and undetectable to natural hair. Then why are you waiting? Get a stunning hairstyle with hair transplant.